Okay, well, good morning, everybody. Welcome to the CCPU Health Care Fund webinar. I'm so happy that you all could be here with us today. We're going to begin by displaying an English and Spanish presentation, or I'm sorry, pardon me, we will be displaying an English and Spanish presentation on the screen. To access this presentation in Chinese, please visit ccpuhealth.org/resources. Again, that's ccpuhealth.org/resources, which will be on the main menu of the website. There will be a download section with both English and Spanish and Chinese slide versions in PDF form for you to download. So with that said, good morning once again. My name is Joe Scala. I am a staff member of both SEIU Local 99 and CCPU, and I am also one of your CCPU Health Care Fund trustees. There will be more on a moment on me and our other healthcare leaders and trustees. Okay. Now I'd like to introduce our CCPU Board of Trustees. The Board of Trustees consists of 6 representatives appointed by CCPU with representation from the 3 local unions. As you can see, we have from UDW, we have Horace Turner, our chair, Jackie Galliano, his colleague. From SEIU Local 99, we have Yvonne Cottage, also our secretary on the board, and yours truly, me, Joe Scala. From SEIU Local 521, we have Patricia Moran, who has also joined us today and will be presenting later. And last, but absolutely not least, Rico Mendez. Okay, in this presentation, we will be providing an overview of the CCPU Health Care Fund, and will guide you through a demonstration of the application process. The best way to get updates on the CCPU Health Care Fund is to sign up on ccpuhealth.org and get the latest and most recent information from the Healthcare Fund as soon as it becomes available. During this presentation, a QR code will be available on the screen so you can scan with your smartphone and access ccpuhealth.org. And I'm excited to share that the CCPU Healthcare Fund website is available in English, Spanish, Chinese, and Arabic. So if you've just joined, good morning. Once again, I am Joe Scala, SEIU Local 99 and CCPU staff member and a Health Benefit Fund trustee. And again, I'm excited to be here, excited you're here. Today is the second of many more webinars and info sessions about our groundbreaking CCPU Healthcare Fund. We're going to review CCPU Healthcare Fund reimbursement plan benefits, the eligibility requirements, and provide a demonstration of the application process. There will also be time for questions at the end of the presentation. As I said earlier, we're going to have many more info sessions, and there's a phone number on our website if you have questions in the meantime that you'd like to get addressed that way as well. CCPU recently won $100 million annually from the state of California to help pay for eligible healthcare providers to reduce or eliminate healthcare expenses. We surveyed providers to understand better exactly what the barriers were to accessing affordable, high-quality healthcare so that providers are able to work and enjoy life. The survey confirmed what providers have been organizing around for years. Healthcare premiums and out-of-pocket costs are too high for many providers to get the healthcare you need and for some to afford health insurance at all. CCPU's Health Fund is designed to address those problems for eligible providers. It is important to know that these benefits work with your health plan. They do not replace your health plan. This allows us to cover more providers with the available funding. The CCPU Health Care Fund will cover benefits for eligible providers for expenses such as health plan out-of-pocket costs, including medical copays and deductibles, pharmacy copays and deductibles, and some health plan monthly premium expenses. All right, so this concludes my portion of the presentation for now. So I would like to turn it over again to my dear colleague on the board and your fellow childcare provider, Patricia Moran. Patricia, please take it away.
Thank you, Joe. Good morning. My name is Patricia Moran. I'm a childcare provider and I'm part of the negotiation committee and also the healthcare funds trustee. I'm so excited to be in this webinar. It's something is historic. It's a great victory for us, for all the providers. And one of the great advantages of the CCPU Health Care Fund is that benefits are available for every eligible provider, regardless of what type of qualified health plan they have. Benefits are available for people on Cover California, medical, Medicare, Medicare Advantage, both medical and Medicare, also known as Medi-Medi plan, an employer-based plan. And for those who are uninsured, we can help you in enrolling in a qualifying health plan. We are excited to announce the applications are now available on our website at ccpuhealth.org. You must apply to receive benefits. The great news is that benefits will be effective for covered service you receive as of January 1st forward. This means that if you meet the eligibility requirements, you will be able to submit expenses for reimbursement from January 1st, 2023 forward. Please sign up on the website to get the latest information and details of when you can start processing requests for reimbursement. Our website is a great resource as we are continuously updating our frequent questions on the website with information based on your question. This also where you will find instructional videos as well as recording of these webinars. If you are more comfortable calling, you can reach us as 833-714-6028 from 8 to 5 each day. Applications are now available on our website at ccpu.org. It is very important to understand the benefits that we are describing are not a traditional health plan. They are reimbursement plan. This is important. So do not cancel your health plan. You sign up for our healthcare fund to help pay for your share of the cost of your health plan. How do you become eligible for CCPU Health Care Fund benefits? There are 3 steps that we will review here in how to become eligible for benefits. First, you must be paid for work with a subsidized child. Second, you must enroll in qualified health insurance plan. Third, you must enroll in the CCPU Health Care Fund by completing the CCPU Health Care Fund application. To be eligible for CCPU Health Care Fund is for Healthcare Fund benefits starting January 1st, 2023, you must enroll in a qualified health plan. If you miss it, Cover California's open enrollment for the 2023 plan year, a special enrollment period, SEP, has been issued by Cover California that allows providers to enroll or make changes to current enrollment between February 1st, 2023 through February 28, 2023. For example, if you aren't on cover and want to sign up to be eligible, you can do so. Or if you are in a bronze or a gold plan and need to switch to a Silver HMO plan, which is the requirement to receive CCPU benefits, you are able to switch during this enrollment period. If you need help enrolling in a qualified health plan, please visit our website. It's www.ccpuhealth.org/help enrolling. For additional resources, this agency listed are not only approved by Cover California to assist you in enrolling in Cover California, but they also know about CCPU's Health Care Fund and can provide that information to you as well. I would like to take this time to introduce Pinnacle Claims Management, Inc., the CCPU Health Care Fund's third-party administrator. Pinnacle will handle all administration of the Health Care Fund, including eligibility, verification, claims, reimbursement, customer service, and more. We have Steve Mangapi, Chief Operating Officer, and Bobby Moore, Vice President of Key Accounts, to provide us a demonstration of the CCPU Health Care Fund application process.
Thank you, Patricia. Good morning, everyone. Steve Mangapit from Pinnacle, and as Patricia said, we are the administrator of the program for CCPU. So today, what we want to show you is the application for the program. So let me pull this up on the screen here. This is your website, ccpuhealth.org. And you'll notice today we have gone live and we have an apply now button here and here. This will take you to start the process of completing your application for the program. What I'm going to do today is show you the paper application, and we'll walk you through on how to fill out the online application, which is the easiest and quickest way to get your enrollment application submitted to us. So if I click on Apply Now, take me to a page here that tells you what you will need in order to complete your application. So to complete your application, you need the following information. Number one, we need some information about you, the provider, like your name, your address, so on. We need information about your medical health insurance plan, whether that's Medi-Cal, Medicare, Cover California, or another plan. And we need a copy of proof of coverage that you are on that plan. If you do not currently have a health insurance plan, you can still start your application, and we will connect you with resources to help you get enrolled in a qualified health plan, and then you can return to your application and complete it. You'll see here a button to continue to the application, but before I do that, I want to show you there's a downloadable form here. If you click on this, it'll bring up a paper application copy that you can print out if you want to do a paper application instead of an online application. We'll get back to that in a minute. One thing I want to point out here is that the application for the program is only one page. So it's not too difficult to fill out the application and get it submitted. So if I continue to the application, it looks like this. There's a login page here. For anyone that has already started their application, you can log in to pick up where you left off and continue your application. But for most providers, I would imagine, being your first time here, you do not have an account yet and you need to register. So I will start with the registration process. You click on the button that says register. There's a simple registration form here. On all of our forms on the online application, you might notice a red star on some of the boxes. The boxes with the red star are required fields. You must enter in the answer on these boxes in order to continue. Any questions that do not have a red star are optional, and you can enter in the answer or you can skip that question. So I will put in my name on the registration here. And my email address. The next box is my mobile phone number. The next box is my preferred written language. And your choices here on the drop-down are English, Spanish, Chinese, Arabic, or other. I will pick English for me. And the next box is your password that you can set for accessing the website. If I click on the password box, you'll notice we have shared with you the password requirements. At least one lowercase letter, one capital letter, one number, one symbol, and at least 8 characters total. As I type in my password, these red X's on the requirements will become green check marks as I've satisfied the password requirements. See, I've got all green checks now. I've got a good password. And then the next box is confirm password, where I will re-enter that same password to make sure that I've got it correct. After I've re-entered the password, I can press the button that says register to move on. I've clicked on that and I've got a message that says, thank you for registering. In order to log in, please verify your email address by clicking on the link emailed to you. If you did not receive an email, we will gladly send you another one. So if I go back to my email, my own email, I have an email now from Child Care Providers United Healthcare Fund. That's us. And I have to click on the button that says verify email address to verify that this is really me. And once I click on this button to verify email address, now my account is set up and I've entered into the application portal. We can start with the application by pressing the Apply Now button, but let me share with you a little bit about this dashboard page that we're starting on. You can see I've got my name here and an application ID number. If you ever need our help and you're looking for help in completing your application, this number would be helpful for us to find your application to assist you. You also will notice in the top right, I have my name here, and I can go in and update my profile, change my password, or I could log out. On the left-hand side of the application, we have this dashboard. There's an enrollment application button. And then if you need help, you can contact us, or you can link back to the CCPU website to get program overviews, resources, or the FAQ. The bottom of the page, we also have a button where you can send us an email if you have a question or need help, and the phone number for our service center that is here to help you Monday through Friday, 8 to 5. So let's start the application. So I will press the Apply Now button, and it will take me to step 1 of the process, our profile information. So these numbers across the top, as I move through the steps, it will be checked off and highlighted on where I am in the process. Step 1 of the process is a profile for me on my application. You'll notice that some of the answers are already here because they were pre-populated from the registration that I did on the website. So we are not asking you to enter in information that you already told us. I can update my name if I would like. I can add my middle name. You'll see this does not have a red star, so this field is not mandatory. My last name is correct. And I can pick a suffix like junior or senior if I have one. If I move, I can see the email address and my phone number. And then I have to enter in my date of birth. The date of birth you can enter in by typing in the numbers in the box for your date of birth, or you can click on this icon and choose the date from the drop-down menu. I will type in the numbers, January 1st, 1980. The next box is requesting a social security number or an ITIN number. If you do not have a social security number, you can put in your taxpayer ID number here on the application. If you have neither a social security number nor an ITIN, you can contact our service center and we will help you get a paper application submitted and processed. So here I will put in a social security number. And then the next box is for my address. I will enter in my address here. And then the next box is the city, my address. And then the state is a drop-down. I would imagine many of you are living in California. And then the next box is the zip code. The next section we have here, there is a blue check box here that says mailing address same as above. So if your mailing address is the same as your address, you can leave the blue box checked and we'll know it's the same. If you have a mailing address that's different than your address, like a PO box, for example, you can uncheck this box and enter in your mailing address as well. For my application, I will leave it the same as above. The next question is my preferred written language, which was copied over from my profile registration. I can change that here if I would like. And the next question is provider type. This is a drop-down. This is a required question. We would need to know if you are a licensed provider or you are family, friends, and neighbors license exempt. If you are not sure, you can choose not sure. If you do choose licensed, a new box will open up asking you for your license number. That is required. If I'm a family, friends, and neighbor, it won't ask me for a license number because I do not have one. The next box is your business name. If you have a business name, I can type in my business name here. This will help us match your eligibility verification if you have a business name. This is optional. If you do not have a business name, you do not need to put anything in this box. The next question here is gender. This is also an optional field. If you choose not to answer, you can skip this question. The choices are male, female, other, or prefer not to say. I will choose male. The next question is ethnicity. Again, this is an optional question, and you can choose to answer this or not. There's different choices here. I will say I prefer not to say. And then the next question is also optional. You can answer or not. It's, are you a member of Child Care Providers United? Yes, no, or not sure. And finally, the last question on step 1 is, how many subsidized children do you work with on average? Our choices are 1 to 3, 3 to 5, or 5 or more. Again, you can skip this question if you choose not to answer it. It's not a required field. At this point, I can push the button to save for later and then come back and finish the application, or I can press the green button that says next to move on to step 2. So let's move on to step 2 by clicking next. What we see here at the top of the page, a note, we found a better address match. So what the system has done is it looked at the address that I entered in on the application against the US Postal Service database and is updating the address, which will help the fund and the post office deliver mail to you more accurately and more quickly. In this exact example, you'll notice I entered it a zip code with 5 digits and it's been updated to the 9-digit zip code. Question here is, would you like to use this address? I can choose yes or no. In this example, I will say yes. And now we have a message, success, the address has been updated. Please click the next button to continue. So I will press the green button next. And now I have a check mark on step 1, and now I am on step 2. Only one box here. It says current health plan, select your health plan. This is a drop down, and you'll see my choices here are Covered California, Employer Plan, Medi-Cal, Medicare, Medicare Advantage, Medi-Medi, or I do not have a qualified health plan and need assistance with enrollment. Some of these choices, if you choose them, will open up another question that you would need to answer. For example, if I choose Covered California, I will be required to enter in the name of the plan I have with Covered California. If I choose Employer Plan, we need to know if you're on the employer plan as an employee or as a dependent. What that means, if you're on employer plan as a dependent, it means it's your spouse's employer that you're getting your insurance through. One thing I want to point out here, if you choose, I do not have a qualified health plan and need assistance with enrollment, we will have a message here for you. It says, if you do not currently have health insurance, enter your household size and income, then save for later, and we will connect you with someone to help you enroll in a qualified health plan. So this is really for people that do not have health insurance. We are here to help you get on a qualified health plan. And then after you get on a qualified health plan, we can get you enrolled in the CCPU Health Care Fund. We are asking for your household size and your household income. This is the taxpayer and the number of dependents for the family. So the household size, I could pick whatever the number is, and then the household income is an estimated amount of the total annual household income. For example, let's say it was $35,000. This information is important because this will help us determine who is the right resource for us to connect you with to help you enroll in a qualified health plan. If I didn't have insurance, I would answer these questions and then press save for later. And then someone from our team would reach out to you and connect you with someone who can help you enroll in the right qualified health plan. But for today's example, let's pretend that I'm on Covered California. The system is asking me now, what is the name of my Covered California plan? And very common plan that you might be on if you're in Covered California would be Kaiser. So let's say I have Kaiser Silver 80 HMO. Entered in my Covered California plan name, and I'm ready to move on to step 3. I'll press the green button for next. And now you can see I have a check mark on step 2, and now I am on step 3. Step 3 is proof of coverage. So what we need in order to process your application is something that shows your name, the name of your health plan, and a date to show that you're currently enrolled in that health plan. We have a lot of flexibility here. There are a lot of different types of documents that we would accept as proof of coverage, as long as they have your name, the name of the plan, and something with the date on it. You can upload a file from your computer or your phone on the application to show that proof of coverage. The way you do that is first picking the file description. So in this case, let's say I have a healthcare ID card. I would choose that, and then I would choose this button labeled Browse. If I click on that, I can pick the file from my computer. I have an example file here called Proof of Coverage. And then I've got it loaded in, and then you press the button called Upload Files. Now you can see the system is showing me that I have uploaded files for my healthcare ID card, Proof of Coverage. If I uploaded that file and by mistake, I can click delete and delete it from the system. I can upload another file if I have another document that I want to upload for proof of coverage. As long as we have proof of coverage with the name, the health plan, and a date on it, you only need to have one document and submit it. If I've completed this step, I can click the green button to next and move on to the final step for the application. Now I've completed step 3 for proof of coverage, and now I'm on step 4 for sign and submit. So this page is the opportunity for you to make sure that all the information that you have entered is correct, and then sign and submit your application. So you can review what you have typed in on the previous pages to make sure it's correct, and look at the sign and acknowledgement page. If you find something on this page that you need to go back and update, for example, if you spelt your name wrong, you need to go back, you can press the button called back to go back to the step that you need to fix, and then move forward again in the application. In this case, I've reviewed the page and everything looks correct to me. Then I would go to this box here and check the box, but I understand and agree to these terms for the application, and then I can press the button for Submit Application. So I'm going to go ahead and click Submit Application. The system now took me back to the dashboard, and you can see that my status has changed to pending. And there is a message: your CCPU Health Care Fund application is pending review. An email notification will be sent when the status changes. You will also find that you have a new email from CCPU Health Care Fund that you have successfully completed your application We will reach out to you if we need additional information while your application is under review. So what we have now is the team at Pinnacle will then review your application and check to see if you meet all of the eligibility criteria, including matching your name to our database of payments to subsidized providers to see if you met the work requirement for eligibility for the healthcare fund. And that's the online application. So there's not too many steps here, and you can fill out the application online on our website. This is the easiest and quickest way to get your application submitted. If you would prefer to do a paper application, you can click on the downloadable form button, and it will pull up the paper application that you can print off, or you can start typing in and then print it off. You'll notice on the paper application, it is the same exact questions that we have on the online application. If you do a paper application, please make sure that you include with it the proof of coverage so that we can process your application. On the second page here, we have some information for you that explains, again, what we need for proof of coverage. So that is the application process. And I'll stop there. So again, just to recap, we have the online application. We also can process paper applications. And if you need a copy of the paper application, you can contact our service center and we will get a copy of the paper application sent to you. We also will have coming very soon the paper application available in Spanish. I would recommend, if you're interested in the Spanish paper application, please make sure you sign up for updates on ccpuhealth.org, and you'll be the first to know when the Spanish version of the paper application is available. Now, I'd like to hand it back to Patricia.
Thank you, Steve. Thank you. This is amazing. This is a great moment for us, for all the providers. This is a great help, and it's historic. I'm gonna say too many times. It's a huge victory. For 17 years, family childcare providers fought for you to have the right to unionize. At the end of 2019, Governor Newsom signed AB 378, Building a Better Early Care Education System Act, which allowed 40,000 childcare providers to vote and become a union. And 97% of California daycare providers vote yes to unionizing. This win gives family daycare providers the right to negotiate with the state for improvements to the early childhood education system. Our first contract agreement was $1 billion agreement, and we deserve more. I'm here to ask all providers who are not union members to join us. Visit our website, website page, childcareprovidersunited.org. You should join the union because there is so much more we deserve and so much more that needs to be changed, fixed, and corrected, such as a rate reform, meaning we should get paid on the true cost of care. Reimbursing providers based on enrollment and not attendance. Eliminating parents' fees permanently. And let us not forget about the retirement fund. We need every provider in California to join our union, Child Care Providers United. Join us when we have actions at the state capitol, so we can show how united and powerful we truly are. When providers are organized and use their collective power, we can force all decision makers, from the governor to legislators to wealthy corporations, to pay more attention. We need providers to join and use their voice on the steps of the state capitol so that the decision makers can see us and hear us. When we go to Sacramento, we make our presence known, because when we fight, we win. We make things happen by working together and being united. So far, we won things such as our first COVID agreement, 14 paid days. Second COVID agreement, 16 paid days. Funds for mental health, supplemental pay, our $40 million training fund, infrastructure, Black grant, and family childcare providers had never been included in this grant before. And of course, our healthcare fund. This is why we unionize and why we fight for our right and the benefits we deserve. We need you to join us and stand by side by side as demanding change. If you have any questions, please put them in the box, in the QA box alone. But don't forget, join us, because together we can change things, together, to be united. And sí se puede, because when we fight, we win. Don't forget your questions. Don't forget your question. Put them on the QA box along with your phone number and email address, and an organizer will contact you. And remember, when we fight, we win, and we can do it. Y sí se puede. I'd like to introduce Steve Mangapita again, and Bobby Moore for more information and questions. Thank you.
Thank you, Patricia. I really appreciate it. So we have been getting a lot of questions. You guys are submitting a ton of questions, and we want to answer some of those frequently asked questions. So we're going to start with, can you advance the slide? We're going to start with, does CCPU Health Care Fund provide health insurance?
The answer to this question is no. This is not a health insurance plan. It is a reimbursement plan that works with your health plan. In fact, your application can't be completed unless you have a qualified health insurance plan. So the plan, the CCPU Health Care Fund, helps pay for the costs that are part of your responsibility on your health plan. So it works together with your health plan. And again, if you do not have a qualified health plan today, we can help you find and enroll in a qualified health plan.
Great. Next question we had, Steve, was what expenses are reimbursable for providers who are on a family plan through Covered California?
That's a great question. The fund reimburses for expenses like medical copays and deductibles, your out-of-pocket expenses, including pharmacy copays and deductibles, as well as some of your health plan monthly premiums. The important thing to know for those of you that are on a family plan with your spouse and your children, the reimbursable expenses are only for you, the provider. The CCPU Health Care Fund does not cover the expenses of your family members.
That's a great call out, Steve. We've got a lot of questions in the Q&A that were asking about their family, so I'm glad we were able to answer that. Okay, so the next question that we have is, why does the CCPU Health Care Fund only cover Silver-level HMO plans? And we've got a lot of those questions in the Q&A right now as well.
The reason why that the CCPU Health Care Fund only covers Silver-level HMOs is because those plans are the most cost-efficient plans. And that's the way to maximize the benefits for as many people as possible. And it allows this fund to provide the richest benefits to the most number of people.
Great. What if there are multiple providers on one license? And we have an example that was submitted. I have 2 people under my license and an assistant. My daughter and I are on my license, and I also have an assistant who works for me. Who is eligible?
This question is a good one. Currently, the CCPU Health Care Fund covers only one provider per license. If you have multiple individuals on your license, the benefits will go only to one person. And part of the process when we approve your application, we're looking at who was paid by the state on the subsidy program. So if you remember, one of the eligibility criteria is being paid for work with a subsidized child. We get a copy of those records of who was paid, and we match that up to your application. But today, only one provider per license.
Great. We have this question a lot in the Q&A. Are dental and vision benefits available?
Dental and vision are not available currently. What we are looking at, though, is the healthcare fund is looking to enhance the benefits available for future years. So I think Patricia would tell you to keep fighting, and you can expand your benefits possibly in the future if you win more. But today, the fund benefits are only for reimbursements on your medical and pharmacy plan.
We have a couple other ones in the chat that I want to bring up. We don't have slides for them. The one question I got was, what do I need to complete the application for the CCPU Health Care Fund?
What do you need to do? What do you need in order to complete the application? We have that on the website. So when you click on the Apply Now button, the website will tell you what you need. But as a reminder, if you recall, the application that we went through online, we need information about you, so your name, your address, your social security number, and so on. And we need information about what medical plan you are on, if that's Medi-Cal or Medicare, or a plan on Covered California or another plan. And we need a copy of that proof of coverage for that medical plan.
Great, thank you, Steve. We had another question about what is a subsidized child? What does that mean?
A subsidized child it's a child that you would be taking care of, whose family receives government-sponsored financial assistance. So some of the payment for that care is paid for by the state. The subsidy must come from a qualified state-funded program. And please note that local or county-funded programs do not count for qualifying for this benefit as a subsidized child.
Great, thank you, Steve. Are there any fees with signing up for the CCPU Health Care Fund?
No, we're not here to take the money from you. We're here to get the money to you. There are no fees involved. There's no application fee, and there's no fees or costs associated with being in the program. Just apply, and if you're eligible, you will become eligible to receive benefits from the CCPU Health Care Fund.
Great. We're getting this question a lot too, Steve. What are the premiums going to be?
That's an interesting question. So if you think about the question we answered earlier, this is not health insurance. So we do not have premiums, and there are no fees for being in this program. So this is a reimbursement plan that works with your health insurance. It doesn't replace it. You can't enroll, you can't complete your enrollment unless you get on a qualified health plan. If you're not insured yet, we can provide you resources to help you find a qualified health plan. And whatever that health plan is, if there's premiums involved for that plan, the CCPU Health Care Fund is designed to help you pay for those premium expenses.
Great. Am I able to sign up if I already have Covered California and paid the first installment?
Yes, and we hope you do. You're able to sign up if you're enrolled in a qualified health plan, and that does include Covered California, as long as it is a Silver-level HMO plan. To start that process, you need to apply on our website or through the paper application. And eligibility calculations will be verified once you've completed the application. If you've paid for January already and become eligible, you can submit those expenses after we go live next month and be reimbursed for those expenses.
Great. Next question I have is around Covered California again. I do not qualify for Covered California health insurance. I am paying directly to Kaiser. Can I still get reimbursed?
That might depend on your specific circumstances, but in general, an individual plan where Kaiser would have to be on Covered California through a Silver-level HMO. There are only a few scenarios when someone is not eligible for any qualified health plan, including Covered California. For example, undocumented person that is above the income threshold for Medi-Cal, but can't enroll in Covered California, that would be an exception. In those cases, we would have to work with you through our service center to get your application approved.
Great. We have a couple variations of this question, Steve. I'm on a bronze plan in Covered California. Some have said I'm on a gold plan with Covered California. How do I change to a Silver HMO plan?
It's a good question. Normally, on Covered California, you can only change your plan during open enrollment, or if you have a life event like having a child or getting married. Open enrollment ended last week on January 31st. However, your CCPU Health Fund and your trustees were able to get special permission from Covered California in what is called a special enrollment period, which is during the month of February. So this is a very special thing only for CCPU, where you can enroll and change your health plan in Covered California to a Silver HMO during the month of February, and that would be effective starting in March. So if you're not on a Silver HMO and you're on Covered California, or you don't have insurance yet, this is the month to get on the Silver HMO so that you can qualify to be enrolled in the CCPU Health Care Fund. If you need help enrolling in Covered California, we have resources available for you that have been specially educated and trained to help providers like you, and they understand what plan you need to be enrolled on, and they're ready to help.
Great. The next question we have, we've answered this before, but we can reinforce it here, which is, are the applications available in Spanish?
That's a coming soon. So we just finished the English version of the paper application, and we are going to have it rolled out in Spanish very soon. And as a reminder, if you sign up for updates from us on the website, you'll be the first to know when the Spanish version of the application is available.
Great. Here's a question about deadlines. What is the deadline to apply for January 1st initial eligibility period?
Your trustees have made a decision to make this as easy as possible, and they've extended the deadline to apply for January 1st out all the way to June 30th of this year for an eligibility start date of January 1st. Due to the launch of the program, that's why it was extended. That means if you meet the initial eligibility requirements, you can be reimbursed for covered expenses all the way back to January 1st of this year going forward.
Great. Here's another, I think, really good question. What does the CCPU Health Care Fund eligibility rules require you to work with a subsidized child?
Why are you required to work with a subsidized child? I think another way we received this question was, what if I don't work with a subsidized child? Can I receive these benefits? CCPU negotiated with the state of California to be awarded the funding for this program. And it is through CCPU's relationship with the state and its relationship with subsidized providers that they can provide this benefit. They encourage all providers to accept subsidized children, if able, so you can participate in the program. Michael, I saw you jumped on. Did you have a comment?
Just on this in particular, currently with the law, the state law in California, we're limited to right now to providing these benefits to subsidized family child care providers. We want to expand that moving forward, but at this moment, as of today, we're only allowed, and our hands are tied. It's not something that we wanted to have happen, but right now we are limited by the law to only providing benefits like this to those family child care providers who get subsidies from the state. Sometimes there can be brief interruptions, as you've heard from the eligibility. You don't have to have a subsidized child every single day you're operating. That's why we have the window period of time that you have to need subsidized children for at least a significant part of that window. But we're still working on this. We're not done, but as of today, it's only for those family child care providers who have some subsidized children in their care.
Thank you for helping with that question, Michael. Appreciate it.
Yeah, great. Thank you. And this is the last one that we have. Do the CCPU healthcare funds roll over to the next plan year?
To the next plan year, I think we're talking about 2024. So the funding from the state stays with CCPU Health Care Fund. So that any funds that are not used this year by the program will be available for providers in future years in aggregate. But on an individual basis, the fund is designed to reimburse providers for your premiums and your out-of-pocket expenses. Every year, that number will start over and reset.
Great. Thank you, Steve. Those are the questions that we have pulled out. I'm going to turn it back over to you, Joe.
Thank you, Bobby and Steve, for that great presentation. Also, thank you to Patricia. I hope everyone learned a lot today, and just want to encourage everyone to continue to ask questions. Please visit the website and review the information there. And above all else, please please apply for the program. That this benefit is here for you, and we want folks taking advantage of it as much as possible. But with that said, this is the end of the program today. Thanks again so much for joining us. It's our collective participation and effort that's going to ensure that the family child care profession will continue to make strides and grow into the future. So let's continue to take care of ourselves, grow, and above all else, on the subject of today, ensure our healthcare needs are met. So thanks again for your time and attention. And again, please sign up on the website to get further updates. You may also email support@ccpuhealth.org. Again, that's support@ccpuhealth.org, or call 833-714-6028 Monday to Friday from 8 a.m. to 5 p.m. again, Pacific time, if you have any questions. Again, thank you again, everybody, and have a great rest of your Saturday. Goodbye.